professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And it is with great honor that I am presenting this with my good friend and colleague, Dr. Michael Zeroni, and students John Hute and Marian Gelisera, who had been also instrumental in working on a grant-funded year-long research project on COVID-19. Look, COVID-19, the pandemic has been devastating for many people's lives. It's affected almost everyone, if not directly by being affected through the disease. They have been indirectly affected through relatives or loved ones who they may have even lost. So this is really, and it was really, if you looked at some of the responses, because when we did the grant study, we looked at qualitative components and quantitative components, and if you looked at some of the responses, and when I'm saying this, I'm being serious. One person even created a song to depict the feelings of almost this impending doom. So this is why it is so important to be discussing about understanding suicidal ideation. So it's really with great honor that we're presenting this in front of the World Psychiatric Association, the 22nd World Congress on this, being held in Bangkok, Thailand. So just for starters, it's definitely sleep problems are ubiquitous problem. Many people have it, and the COVID-19 pandemic just made things worse. Mental health is influenced by a combination of macro systems, ecosystems, mesosystems. So all of these systems are playing kind of I should say a complex interplay. There's a complex interplay between each of these areas. So these factors may have affected the patient's mental health. For instance, a low resource neighborhood. And I'm a mapper. John in our group is a mapper as well, and so we discussed about these things. Low resource neighborhoods are especially areas where there may be more problems and more more poor health outcomes. So on a global scale, you had this global pandemic, of course. And if you can't see some of these, this is talking about the disproportionate rates of COVID-19 among certain populations, increased concern about COVID-19, and then just overall lack of providers. When you had low health literacy to begin with, and then compound this with lack of access to information, language barriers, healthcare utilization, then you have serious issues that are underlying, that are affecting upstream factors and determinants. If you don't get enough sleep, that affects physiologically how you function. Long term, of course, this is detrimental to chronic diseases, and also leads to poor health outcomes. And then when you have something else to consider, just before we go on, just an aside, if you're thinking about all of these factors simultaneously, just think about even the virus itself. And I had seen it said, I had said this in several places, not only in the media, but the Beacons of Light and other places. I'm just talking about how the virus itself actually crosses the blood-brain barrier, and could cause some of these mental disturbances. The amount found so it was found that 4 in 10 people have reported trouble sleeping during the pandemic. So that's quite a bit of people, 40%. And so this was termed a portmanteau term, coronasomnia. And so there was drastic changes in daily routines. People were no longer commuting to work, or people had stopped doing the things that they did. So this had disrupted all patterns. Anyway, so and then you have circadian rhythms and different things. So what we did is looked at the coronavirus anxiety scale and decided to create a scale, and we had multiple discussions before we even conceived this instrumentation to better understand this phenomenon. So we had actually in this instrument assessed quite a few, not only mental health factors with the PHQ 9, but the coronavirus anxiety scale, but also looking for social determinants. Specifically, looking at food insecurity, looking at place-based area level deprivation that might be taking place. So this was actually a very involved grant, quite a few components, but the suicidal ideation question was part of that. And location also was something that was collected within the survey instrument. So around 20% of the population, of the sample, at least of our sample of 287 people, had COVID-19 anxiety related effect. So there was a total of 20%, but then we actually also measured how many people. So how many people just had anxiety, but then how many people had anxiety and said that they were positive for COVID-19, and that was interesting because that was a higher percentage. And so if we look more closely, and I'm gonna just increase the size on that briefly, that's closer to 30%. Yeah, so that's closer to 30%. So this shows, and then so the next distribution that we looked at was sleep disturbances, and it was all across the kind of board. There were people that said that had a lot of, sleep disturbances, had a lot of trouble sleeping, and then very few actually people said they had no trouble sleeping. So most people had trouble sleeping. But when looking at then suicidal ideation, and so Figure 3 looked at this, and so if you look more closely, all of the red dots are related to places where people indicated suicidal ideation. excuse me, all of the blue dots were people responded positive for suicidal ideation. And it may be difficult to see the blue dots, but they're there. And something else that we mapped was trying to indicate areas where people had poor mental health for the last 14 days. And that was quite striking as well. And what was interesting to see is the correspondence. And there's actually a link where you can explore this at a location level, zip code level, this information. But this is, you can kind of see the correspondence between areas with poor mental health days and then areas where people had more suicidal ideation. So the, the lesson here is that the area matters as to how you experience some mental health issues. So now let's take a look at the logistic regression and the results from that. As expected, so insomnia did lead to suicidal ideation. And in fact, it was 4 times higher likely to experience suicidal ideation, not only crude, but when adjusted for demographic variables like age, marital status, ethnicity, education level, even when you adjust for all of those, the adjusted odds ratio will remain the same. So, in conclusion, what's all of this saying? Well, quite a few things. Number one, with COVID, we need to be still concerned about. Yeah, the pandemic might be waning, but we still need to be concerned about some of these long-term effects. Maybe we may have to be thinking beyond just long COVID and thinking about some of the effects of disruptive effects that COVID itself had physiologically on the body, which then creates a cascade and a pattern for the body. So it's important to be screening for mental health and be screening for suicidal ideation, not only for in specialized care, but even in primary care settings, and to understand these issues before they occur. And something else that's important is that when we're thinking about county health rankings and geospatial considerations, that is something that is really important to be thinking about when researching any sort of virus-related problem. So currently we're facing monkeypox. It's been declared a public health emergency just in the last couple of days. So um, as we face future pandemics, some of these um, some of these related issues still will persist. It doesn't necessarily have to be a physiological effect. While it's true that COVID-19 crossed the blood-brain barrier, even if monkeypox or any of the future uh, public health emergencies don't cause this physiologically, the worry that this causes and the cascade and some of that disruption can be detrimental to populations. And to understand the effect is extremely important. I would like to once again thank all of those involved within this presentation and all the organizers of the World Psychiatric Association uh, Conference Congress. Thank you for listening.